Hello, everyone. My name is Christian Brindle, Medicare Health Plan Expert and Specialist. I'm the founder of Brindle Insurance Services, also known as Everything Senior Insurance. And today I'm going to give you the only Medicare video / podcast that you're ever going to need. I guarantee you, you will not need another one by the end. It's going to help you make all the decisions that you need. It's going to help you understand your options in a way that no other Medicare video before has ever done. And I encourage you to listen all the way to the end to make sure that you get every single piece of information. So without further ado, let's get in. Medicare is an extremely complex and convoluted process and system. Anything that's ran by the government is, so there shouldn't be any surprise there. However, if we're going to understand Medicare, we first have to break down Medicare and what it is and go through what your options are as a Medicare beneficiary. Medicare was first passed in the 1960s by Lyndon B. Johnson, LBJ. So it's roughly been around in the ballpark of about 60 years up until this point. So Medicare is originally based off of the concept and the idea of providing healthcare options to seniors. Prior to Medicare even existing, there wasn't any real viable healthcare or health insurance options for senior citizens. Health insurance companies typically would discriminate prior to the inception of Medicare against people that were age 65 or above. And so that's where Medicare really came into the fray to provide a need to solve this problem, to essentially provide an option to where people on Medicare could get quality healthcare. Okay, so Medicare always starts with what I would call the foundation of Medicare, which is essentially original Medicare. With the Medicare system, you actually have two parts of Medicare that come from the government. You have Medicare Part A and you have Medicare Part B. And prior to popular belief, and what most people don't realize, what we find when we work with our own clients, is these are the only two parts of Medicare that actually come from the government. There is no other piece of Medicare in and of itself, only products provided through private insurance companies to pair with Medicare and provide a more complete layer of coverage and solutions for seniors. So understand this first. There's only two parts of Medicare that come from the government. Everything else you hear about that could be considered a part of Medicare is an insurance product provided through an insurance company, okay? So what is Medicare Parts A and Medicare Part B? Well, Medicare Part A and B, also known as original Medicare, as I mentioned, provide a person with medical coverage. Part A covers hospitalization, room and board typically. Part B covers medical, doctor's office appointments, equipment, surgeries, outpatient surgeries, and the works. When you put the two together, you actually have what I would call two pieces of a puzzle that fit together to give you medical coverage. They both cover different things. They both cover different elements of Medicare, but together they cover medical coverage, and they are black and white medical coverage. Medicare does not cover anything that's not deemed as medical coverage, right? So they cover things like hospital stays. They cover things like surgeries. They cover things like lab work. They cover things such as doctor's appointments, durable medical equipment, skilled nursing, rehab, on and on and on. But Medicare does not cover prescription drug coverage. Medicare does not cover dental, vision, or hearing. Medicare does not cover long-term care. There's a multitude of different things like that falls out of the scope of medical bills that Medicare does not cover. But to just understand original Medicare Parts A and B, we have to first dissect what that actually covers, and that is medical bills. Now, Medicare Part A and B both have deductibles. You don't hear about them talked about much because most people on Medicare actually don't pay the deductibles, most notably the Medicare Part A deductible. But they have deductibles. Now, Medicare Part B also has an unlimited 20% out-of-pocket coinsurance. Now, people might say, well, it's just Part B, it's just medical. Why is that a big deal? Well, what most people don't realize is even when you go into the hospital, sometimes people think that since Part A is hospital, that is all that is being billed for your hospital stay. But in reality, Medicare Part A, as I mentioned a second ago, is room and board. Okay, Medicare Part A doesn't cover the doctors that you're seeing, the nurses, the anesthesiologists, the IV in your arm, the lab work they're doing on you, the x-rays they're doing. It's going to cover the room and board. I like to joke with our clients, and I tell them often that Medicare Part A covers the most expensive hotel room known to man, right? It's the room that you're in, but it doesn't cover the room service or the staff or any of the equipment or anything like that, right? So that's a good way to think about it. So Medicare Part B is, in a lot of cases, especially when you're in the hospital, does a lot of outpatient, it does all outpatient things. is going to essentially have a deductible that you're responsible for. But then in addition to that, you have an unlimited 20% out of pocket. You have an unlimited 20% coinsurance that you're responsible for. And this has no limit to it. It has no maximum out of pocket limit like most insurances do. So if you had $100,000 in bills for Medicare Part B specific bills, which is not impossible to do, you could be stuck with 20% of that. So $20,000 as an example. Okay. So that's the holes with Medicare. It's the deductibles that you have to pay for A and B, and it's the unlimited 20% out of pocket on medical bills, not to mention prescription drug coverage, dental, vision, or hearing. Okay. So when you actually work with somebody on your Medicare, like myself, my company is a brokerage. We are licensed in 45 states. We work with a multitude of different insurance companies, and our job is to look through the options available to help you find the best fit based on your needs and preferences. We do it in an unbiased manner all of the time. Okay. So when you work with someone like me, or my organization, or just even if you try to figure this out on your own and try to put 30 hours into it, I've always told our clients that 1 hour with us is equivalent to about 30 hours of doing your own online research. So I highly recommend a consultation, but no cost, no obligation, by the way. However, what you're trying to really accomplish is to find a product through an insurance company to pair with your Medicare to fill in these holes and provide coverage for these areas that you don't have coverage for. Okay. And there's really only two different ways that most people can go to provide this additional layer of coverage for their Medicare. There's Medicare supplement plans with a Part D prescription drug plan on one side, and then you have what's known as Medicare Advantage plans on the other side. And which one is better has been the age-old debate for quite some time now. It, to me, really comes down to the person that you're talking about, their needs, their preferences. And also, one thing you don't hear mentioned often is which area are they living in? What products are available based on the area that they live in? Because Medicare supplements can be more expensive in some areas and cheaper in others, and that certainly plays a role. Medicare Advantage plans can have stronger benefits in some areas and worse benefits in others. And the balancing act of these two also has quite a bit to do with what direction some people go. But in addition to that, it also has to do with your circumstance, your health, your needs. And I'm going to break down both of them for you and give you a really good explanation. Hopefully you're able to follow so we can get you to the end here where you have at least an understanding to determine, I like this better than that, or I like that better than this. That is ultimately, in my opinion, if you can figure out which one of these two that you like better, that's 90% of the battle. Okay. Now, before we actually get into this, people always ask, do I have to get on Medicare at 65? Well, I'm going to break this down real quickly here because there are going to be some people that end up watching this video that this does apply to. If you're working, and if you or your spouse, I should say, is working, and you have credible coverage through your employer, meaning credible coverage meaning coverage through an active employer, a retirement plan is not good enough. Working, let's say you're self-employed and having a marketplace plan or Affordable Care Act plan that has nothing to do with your work does not count. It's not just about having insurance and working at the same time. It's about having insurance, working, and the insurance is being provided from your employer. If you meet that criteria, you have the option of postponing Medicare and not taking it at 65 if you so choose to do so. You can postpone it as long as you want with no penalties and no punishments, as long as you're working, as long as you have that coverage. Okay? So understand that is an option for you. Also, if you are a military veteran, like if you have TRICARE for Life, veterans benefits, if you have a federal employee health retirement plan like an FEHB plan like Federal Blue Cross, Federal United Healthcare, Federal Aetna, Mail Handlers, any of these programs, this also doesn't necessarily apply to you in the same way. You are exempt and you're kind of in a different category altogether. If you guys would like to see us put a video together specifically talking about veterans, but please drop it in the comments below. And if we get enough requests for it, something that I'm happy to do. Just don't have time for it in this video today. But before we jump into Medicare supplements versus Medicare Advantage plans, let's talk about what you pay for original Medicare. Medicare Part A does not have a cost to it. There's actually no premium to it. It's a $0 premium as long as you meet the working requirements. What this means is, as long as you've worked in your life, at least 10 years of your life and paid into FICA taxes, Social Security, Medicare, you paid them throughout all of your working life. If you worked, I'm paying them now. As long as you paid into them for at least 10 years of your life or 40 quarters, your Medicare Part A is no cost. Now, this could also be your spouse. If your spouse has this working credits and you don't, You can draw off of theirs at no consequence to theirs, right? You can both have Part A for no cost. Now, Medicare Part B at the time of recording this has $174.70 a month premium that is standard that every single person in the United States pays no matter what state you're in. The exception to this is if you're in really low income brackets like food stamp levels, Medicaid can pay for your Medicare Part B premium for you. And if you're in a high income bracket, north of $200,000 a year, if you are married, it's a little bit lower of a bar. If you're not married and you're single, they can charge you more for Medicare Part B. They call this IRMA, Income-Related Monthly Adjustment. My definition, I kind of call it a penalty, a punishment for making too much money. But outside of those extremes, everybody pays $174.70 a month for Medicare Part B. We'll call it $175 to round up. So when you have Medicare Part A and B, we've kind of defined and talked about the limitations of what it actually comes with, okay? Unlimited 20% out of pocket for medical, Part A deductible, Part B deductible, no prescription drug coverage, no dental, vision, hearing. Okay, so how do we fix this? Again, Medicare Supplement, Medicare Advantage. Let's talk about the Medicare Supplement plans first. So with Medicare Supplement plans, it starts with Original Medicare, Part A and B, and this is your primary medical coverage. What a Medicare Supplement plan is, also known as a Medigap, if you've ever heard that term before, it's tomato. It's two names for the same thing. Most things in Medicare do have more than one name, by the way. You pick up this Medicare Supplement plan, also known as a Medigap, through a private insurance company. Think about insurance companies like Aetna, Cigna, Mutual of Omaha, Humana, and on and on. There's a multitude of different insurance companies out there that provide this type of benefits. This plan acts as a secondary to your Medicare, and its job is to be a secondary on medical. It fills in the gaps on the medical coverage that Medicare leaves behind. Most commonly, most Medicare supplement plans are going to pay the Part A deductible at least. They're going to pay the 20% out of pocket that Medicare doesn't pay for. In fact, the most popular Medicare supplement plan in the market today is a Medicare Plan G. Medicare Supplement Plan N is probably 1A, 1B, depending on the state in terms of the popularity. But the Medicare Supplement Plan G is the simplest, so I'm going to use it as an example. It pays for everything that Medicare leaves behind on the medical side except for the Medicare Part B deductible, which is this year $240 one time a year. So if you had a Medicare Supplement Plan G and you had Medicare, let's just say you're spending, the price is going to vary tremendously also where you are. If you're turning 65, this price can be anywhere between $100 a month and $200 a month, depending on your zip code and depending on your area. This is something we can look up for you if you reach out to my company. No cost, no obligation. Now, that being said, let's just say, for example, you're spending $150 a month for Medicare Supplement Plan G, just so we have a round number to work with. If you're paying that and you're paying your Part B premium, right, you're looking at probably about $325 a month for the two of them together, okay? And if you had a Plan G, you'd have a $240 deductible one time a year that you are responsible for, and then after that, you have full medical coverage. It's the full medical coverage that you have throughout the entire year, right? Once you hit that, you can best think of that as your maximum out of pocket. So it's the best medical coverage money could buy. You could have $300,000, $400,000, $500,000 a year in medical bills and pay not a penny more than that $240 one time, as long as it's a Medicare covered charge, which most medical things are. And it's looked at as the best medical coverage that money can buy. Now, here's the downside of the Medicare supplement plan. In my mind, it's that it will only pay for things that Medicare covers first. It's a copycat insurance. It's a type of insurance that will only, mirror or mimic kind of what Medicare's already done. So if Medicare approves, let's say, a doctor visit, pays 80%, the supplement comes through and pays 20% because Medicare already covered it first. Okay? So because it only pays for things Medicare has already paid for as a primary, that means you don't have coverage on it for prescription drug coverage, dental, vision, hearing, etc. So you have to pick up separate plans for prescription drug. Enter Medicare Part D. That's why I say you pick up a Medicare supplement plan and you pick up a standalone prescription drug plan, also known as a Part D plan. These are also picked up through private insurance companies, by the way. These premiums can vary. And this year, there's premiums in a lot of markets that are as low as $0 premiums. There's one plan that's a $0 premium. There's others that are in other states, that same plan is 50 cents a month, 75 cents a month. Some can go up to as much as $100 a month for your Part D prescription drug plan. what prescriptions you're taking and the dosages and the pharmacies that you go to is going to have everything to do with which prescription drug plan can be best for you. It's going to vary. It's going to be all over the place. Okay, it's going to depend on your drug needs. So understand that, but it is a separate plan in and of itself. It has nothing to do with your Medicare supplement. A good analogy I like to use most commonly is your car insurance and your homeowner's insurance. Although you can bundle those together and get a discount, that's kind of where the analogy stops because you can't do that with Medicare. But they are separate policies. They cover different things. The Medicare supplement or Medigap covers your secondary on medical, and your Part D prescription drug plan covers your prescriptions. You can get them through the same insurance company if you want to, but there's no benefit to unless you just like that. You can get them through a different insurance company if there's a better fit on the prescription side than on the supplement side. And then if you want dental, vision, and hearing plans, there are separate individual prescription dental, vision, hearing plans, that provide coverage for dental, vision, and hearing. I always tell people that depending on where you are, you're probably looking at anywhere between $300 to $400 per month out the door for all these policies put together. Because you're in a scenario where you have to get 3 to 4 different plans to give you the full layer of coverage. Now, what's the positive of doing it this way? The positive is you have full medical coverage, if not close to full medical coverage. Okay, so you have almost no out-of-pocket. So that scenario I gave you earlier with the Medicare Supplement Plan G, you have a $240 deductible one time a year, and then essentially you have full coverage after that. So that's the best coverage money can buy. It's top shelf medical coverage. You also don't have networks. On Medicare Supplement plans, you can go to any provider in the country as long as they take Medicare in all 50 states. It works the same across state lines. So this is great if you travel a lot or you're a snowbird. It's perfect for that type of scenario. Nowadays, 98% of doctors in the country accept original Medicare. So networks, not a thing. Most insurance policies these days do have networks. What's the negative about Medicare supplement plans? Well, for one, they go up in price every single year as you get older. They continuously raise your price. Every single company does it. Anybody that says there's a company that doesn't do it is typically misinformed or they're just not being honest with you. Every single Medicare supplement company goes up in price. And this price increase can vary. Some might go up 5% a year, some might go up 10% a year, some might go up 15% a year. Just going to depend on that. The other thing that's a negative of Medicare supplement plan is the only time you can get it without health questions is the first time you get onto Medicare. So when you're turning 65, you're in an open to Medicare window when you can get any Medicare supplement plan you want with no health questions, no underwriting. It's a straight shot. The insurance company has to accept you regardless of your prior medical history. But a year down the road, 2 years down the road, 3 years down the road, let's say you're on a Medicare supplement plan that you don't like anymore. The price is shooting up and you want to change to a different one. You have to be healthy enough to pass the health questions to do so. On the flip side, let's say you start with a Medicare Advantage plan and you want to go into a Medicare supplement plan later. Same scenario. You have to be able to pass health questions in order to change the plan. So that's not a problem if you're healthy and you can pass health questions. But if you have some chronic medical conditions and you pick a Medicare supplement plan, picking one at the beginning that's going to have the lowest price increases for you most commonly is going to be the best fit for you. And you can usually determine these things by looking at some metrics and some data and the long-term rate increase history of what a company's done. It's not a perfect system, but it's a very, very educated guess on what things are going to be going forward. So to me, that's the pros and cons of Medicare supplement plans. Now let's talk about Medicare Advantage plans. Medicare Advantage plans you've probably heard a great deal about because they get advertised about like no other. Okay, Medicare Advantage plans are advertised on TV constantly. If you've ever seen anything that says $0 premium plan or get zero cost dental, vision, hearing, zero cost food cards, zero cost this, zero cost that, it's an advertisement for a Medicare Advantage plan, no doubt. Now, I also will say any advertisement you ever see in any format, a mailer, a seminar, a commercial, something online, every single advertisement you ever see is going to be advertising one of these two plans, Medicare Supplement or Medicare Advantage plan, without exception. They just find ways to make it sound like it's something different or new, but there hasn't been anything different or new in terms of these two being your options for about 20 years now. And there's no chance of that changing anytime soon. There is no new special plan that's not one of these two types of plans. So understand this. This is one thing that most seniors have such a hard time wrapping their minds around because they get so much inundation and they do such a good job at making it sound like it's not what they're advertising for. Okay, so the way they do this on Medicare Advantage plans is Medicare Advantage plans are also known as Medicare Part C plans. Why? There's no good reason for it. It's government logic at best. It's because they say you Part A plus Part B plus Part D for drugs equals C. That's their logic. So a lot of advertisers take advantage of this. They take advantage that the public isn't aware that Medicare Part C also means Medicare Advantage, same thing. And they advertise, get a Medicare Part C plan today. Medicare Advantage plans can best be thought of as replacement plans. So it starts with Part A and Part B, original Medicare. You can't get any Medicare plan without original Medicare first. But it starts with Part A and Part B. And instead of running your Medicare through the government like you do on the left-hand side with a Medicare supplement plan, your Medicare gets ran through a private insurance company. This private insurance company administers your benefits for Medicare. It takes on all the risk, all the responsibility for Medicare. Now, that takes a big burden off of Medicare's shoulders, right? Because if they're taking on all responsibility to pay your claims, if they're taking on all the risk to pay your claims, well, then Medicare doesn't have to pay that 80% anymore on your medical bills, right? Pretty good for them. So in exchange, they agree to fund the insurance company every month to take care of your bills, every single month. A lot of metrics in a lot of places in the country have determined that a lot of times on average, Medicare Advantage plans are funded about $1,000 a month per member from the federal government. Because of this, they can offer plans at $0 premiums because they're getting the money, just not from you. So in that scenario, you pay for your Medicare Part B premium, that $174.90 or $174.70, excuse me. And in a lot of cases, that's it. Now, it doesn't mean there can't be Medicare Advantage plans that have premiums in some places of the country or some markets, but in a lot of places, there are plans available that have $0 monthly premiums today in 2024. Now, this plan is going to be more like any other type of insurance you've had throughout your life. They're HMO, PPO plans, meaning that they have networks of hospitals and doctors. You have to stay within the network. It's important to pick a plan that covers all of your doctors and your providers. People complain about the networks, but I always say it's the only reason the network would ever be a problem is because you signed up for a plan that didn't cover a doctor. You didn't have anybody check, or you didn't check yourself. This is not smart whatsoever. Networks are not a problem if you check your providers ahead of time. And some plans have great big networks where you have all different types of options. You have a national provider network in all 50 states. Other plans have itsy bitsy tiny networks where you have very few providers you can choose from. And there's a spectrum of everything else in between. So understanding the networks is imperative. I've always been a fan of bigger networks opposed to smaller networks because we typically with our own clients have the least amount of provider problems with them. Okay. Advantage plans also are all-in-one plans. They give you your medical benefits included. They give you your prescription drug plan. Your Part D is built into this plan. You don't need a separate plan like a supplement plan. You have built-in dental, vision, and hearing benefits. You have built-in additional items of coverage that Medicare doesn't provide, such as gym membership. Silver Sneakers is the most popular vendor. You might have heard of that, or Silver and Fit. They also provide things like over-the-counter item essentials, an allowance usually every month or every couple of months or every quarter to where you're able to use this allowance either by ordering online or going into certain stores where you can order items that aren't prescriptions, but they're over-the-counter items. Allergy medicine, aspirin, ibuprofen, toothpaste, fish oil, Band-Aids, etc. Take your pick. So they cover a much wider variety of things than original Medicare does, but they're not as good of coverage on the medical bills as a Medicare supplement would be. So Medicare supplement has higher premium, has better medical coverage. Medicare Advantage plans have lower premium usually in what you end up paying total because you pay for Part B and Part B only in many cases. But typically that is all you pay monthly, but you have co-pays for Medicare Advantage plans. So a lot of people think they're going to have big, massive deductibles on Medicare Advantage plans. And the truth of the matter is most Medicare Advantage plans, not none, but most Medicare Advantage plans do not have any kind of medical deductibles at all. Most Medicare Advantage plans have what's known as a max out-of-pocket. A max out-of-pocket means that it's a number that is the most that you can spend in a calendar year in medical bills. So once you hit this, you have 100% medical coverage for the rest of the year. And depending on where you are in the country, it could be $1,000, it could be $2,000, it could be $4,000, $5,000, $6,000. So this is going to vary tremendously. But most Medicare Advantage plans, since they don't have a deductible, this doesn't mean you have to pay this number to get coverage. It's not what it means at all. It just means that you have copays for certain items, and these set copays are what goes towards your max out-of-pocket. Let's use an example. Let's say there's a Medicare Advantage plan, and this isn't a real plan, I'm just giving you an example, that has an emergency room copay of $100. Let's say the emergency room visit was $2,000 and what you would be responsible for if you had no insurance. Let's say it's $2,000. You go in, your copay is $100. The insurance pays everything except for your copay. Okay? So understand that. That $2,000 is gone. There's $100 left for you to pay. You pay the $100. That's your copay. Let's say that your maximum out of pocket is $3,000 on your Medicare Advantage plan. Well, you paid $100. So now you're at $2,900 for the rest of the year. And if you ever reach that $3,000 threshold in copays, not deductibles, but copays, then you have full medical coverage for the rest of the year. Most people never get close to these max out-of-pocket numbers, even the low ones, because the way the plan's set up is the copays are usually very low, usually very reasonable, and you have to use it a lot in order to get there. Now, if you're chronically ill, you might. If you have kidney dialysis or if you have chemotherapy, those are the items that we most commonly see people actually reach their maxed out pockets on, or infusions. Those three items, chemotherapy, dialysis, infusions, are usually on most Medicare Advantage plans covered at 20% coinsurance. So you're responsible for 20% of the cost. They pay 80%, and those costs are enormous for dialysis, chemotherapy, and radiation, for infusions. All of those things are very, very expensive. So usually if you're doing those types of treatments, you can hit your max out of pocket in a very short amount of time. That's a very common way that we see people hit their maximum out of pocket number. But it's usually not from hospital stays. It's usually not from emergency room visits. It's usually not from surgeries. It's usually not from doctor visits. Usually those people that have, a hospital stay here, a hospital stay there, surgery here, surgery there, see their doctor a couple times a month, sees a bunch of specialists. Those people usually don't get close on Medicare Advantage plan, but not always, but I would say usually. So Medicare Advantage plans are good coverage. They're not as good of coverage as Medicare supplement plans. So an analogy I've liked to use is Medicare Advantage plan is good, Medicare supplement is better, but it costs more. You're paying more to get the better. So it's not a conversation of bad coverage versus good coverage. They both have their pros and cons. They both have their advantages and disadvantages. And who is being taken into consideration is going to have everything to do with which direction they really should go. That's why you really need a professional to help you through this entire process. But that is the biggest decision you need to make. Once you decide whether you want to go Medicare supplement or Medicare Advantage plan, the rest takes care of itself. The rest of it is actually very simple to find out. And it's incredibly important to make that decision. That's probably, again, 80-90% of the difficulties right there. If you'd like a licensed professional to help you through this process, somebody that knows exactly what to look for, my office can help with this. Our number is 801-255-5340. Again, 801-255-5340. And one of my team members can assist you in making sure that you are going to be on the best plan, and we make sure that we isolate the best plan for you, whether it be Medicare Supplement or Medicare Advantage. We can do both. We are a Medicare-specific organization. We specialize in Medicare health plans. But that is the biggest decision you need to make right there when it comes to Medicare. Anything else you hear about is really just minor little things, right? This is the biggest decision you need to make. And to me, I don't feel like one side is better than the other. People ask me all the time, Christian, which one's better than the other? Which one would you recommend to my parents? Well, my parents are on Medicare Advantage plans, but that might not be the best thing for you necessarily. It's going to depend. My parents wanted Medicare Advantage plans. It has everything to do, to me, with your situation, your location, your needs, your preferences, every single time. And we'd love to be able to be a catalyst in order to helping you simplify this. I've told people, like I said at the beginning, 45 minutes to an hour with us will equivalent. You'll learn more than you'll learn in 20, 30 hours of online research. And it'll be more clear. No propaganda, no biases. We are here to help. Anyway, folks, I hope you enjoyed this video, and I hope it actually lived up to the promise of being the only Medicare video that you ever actually need to watch to make a good decision with your Medicare health plan. If you enjoyed this video, please do me a favor, like the video. It helps more people on Medicare, about to get on Medicare, find the video in the YouTube algorithm that need to hear this information desperately, that are confused. Make sure you comment down below. What are some questions that you have that maybe we didn't get to? We'll be happy to answer them for you. Make sure to subscribe for more Medicare content. We put it out on the weekly basis for you to make sure that you know exactly what you're doing. You have all the tools to make the best decisions possible. And without further ado, thanks so much for watching. I enjoyed our time together, and tune in for the next video. We try to never disappoint. Happy Medicaring, everybody.